the next video is going to show myself, a research nurse, in a discussion with a patient to explain more about the ACNEC trial and what it would involve for a patient. So hi, Jan.
Hello there.
So we think that you may be eligible to take part in the ACNEC breast cancer research trial. So I'm here to tell you a little bit more about it. So first of all, you don't have to take part in the trial, and you can decide once you have a clearer idea of what it is and what is involved. So to start with, I was wondering if you could just tell me what you understand at the moment about your breast cancer diagnosis.
Yes, I've just been diagnosed with cancer in my right breast, and I've been told that it's spread to my lymph glands here under my arm. I had a biopsy which detected the cancer cells there.
Okay, thanks. So we call this area under your arm the axilla. So okay. First of all, we would offer to give you chemotherapy to try to shrink the cancer both in your breast and in your axilla. The chemotherapy is what we call a systemic treatment, which means that it travels in your bloodstream and it can attack cancer cells anywhere in your body. So the chemotherapy given before breast surgery is called neoadjuvant chemotherapy. And if we can shrink the cancer in your breast using this type of chemotherapy, then the surgery that we do after that can be much simpler, and you may have fewer problems afterwards.
Okay, I think I understand that. Is this treatment offered to everyone with the type of cancer that I've got, type of breast cancer that I've got?
Yes, it is. It's currently what we call the best standard treatment for this type of cancer.
So once I've had the chemotherapy, I would then have surgery to remove the cancer in my breast, is that right?
Yes, that's right. And if the cancer is small enough, the surgeon will just remove it, and that is called a lumpectomy. If that isn't possible, the surgeon may need to remove the whole breast, which is called a mastectomy.
Okay, well, what about the lymph glands, which I've been told have cancer cells in them at the moment?
Okay, so right now the standard treatment includes surgery or radiotherapy to the axilla following chemotherapy to the armpit. But what we're sometimes seeing is that the chemotherapy given before surgery, the neoadjuvant chemotherapy, can be so effective that the cancer cells in the lymph glands have been destroyed and can no longer be seen. And we're finding that this happens in 40 to 70% of cases.
Okay. Does this mean that surgery or radiotherapy to the armpit may be unnecessary then?
In cases where the cancer cells in the lymph glands have been destroyed, then yes, but we don't know for sure, which is why we need to do this trial to find out.
Mm-hmm. But why would I agree not to have that surgery or radiotherapy when there is a chance that I may need it?
Good question. We are not sure if you need it. The problem with the treatment to the axilla is that it can cause a lot of side effects. So it can cause pain and stiffness in the arm and the shoulder, and an arm swelling called lymphedema.
I've heard of lymphedema. Does this happen to many people?
For every 5 patients who have all of their lymph glands removed, 1 patient will get problems with lymphedema.
Yeah. Is lymphedema much of a problem for people?
It can be. So some patients get a very mild swelling, but in the worst cases, the whole arm can swell up and can cause a great deal of pain.
Is there any treatment for it?
At the moment, we can try to control it and manage the pain and the swelling, but no, we can't cure it. Because the lymph glands have been removed or have been damaged by radiotherapy, there is a break in the whole system. So then the lymph cannot drain away properly, so it builds up in the arm and causes a swelling. So some people will then wear a sleeve permanently to help to reduce the swelling.
Okay, so perhaps you might like to tell me a little bit more how the research study will work?
Yes, of course. So first of all, before the chemotherapy is given, the lymph gland with cancer is either marked with a clip or with a black dye. And then once the chemotherapy is finished, the surgeon operates on the breast, removing the tumour which is left. They also remove the marked lymph gland in the armpit and a few of the lymph glands that are surrounding that marked gland. Those lymph glands are then examined under a microscope. If there is no sign of any cancer cells in these glands, then the patient can be randomized into one of two study groups. One is standard armpit treatment, and the other is no armpit treatment.
Okay, what if the glands which are removed do show that there are cancer cells still there?
In that case, you would go on to have further armpit treatment and you wouldn't go into the trial.
Okay, I see that. And if I do go into the trial, could I decide which study arm I go into?
No, you can't. It is really important in a research study like this that neither you nor your surgeon nor your research nurse can choose which study group you go into. So we use a computer program to put you into one of the two groups. This makes sure that you would have an equal chance of going into either group, and that whole process is called randomization. And it's done to make sure that the results of the study are correct and that there is no bias, so no skewing of results because of choosing, which could affect the results.
Can you just explain that again for me and to think about it a little bit more?
Yeah, it's complicated. So by not allowing any choice on your part as a patient taking part in the research study, or your research nurse or your surgeon who enrolls you in the study, it just makes sure that the new treatment is tested against the current best standard treatment. So research nurses or surgeons are unlikely to deliberately bias or to deliberately skew a research study, but they might do it without realizing. So for instance, they may be more inclined to put less well patients into one particular study group. And then if the patients in this group don't do as well as the patients in the other group, it may look as though one of the treatments works better than the other one, which actually it really doesn't. So randomizing also ensures that there are few differences between the two groups in terms of the people taking part. So the research team will put information about the people taking part into the computer program, and that information might include things like their age, their gender, the stage of their cancer, and that just makes sure that the two groups are then as similar as possible. So that way, the researchers know that if one of the groups does better than the other one, it is because of the different treatments and not because of general differences in the people taking part.
Okay, that's better. I think I see that now. Thank you.
Okay. Mm-hmm. So in the ATNEX study, anyone in the current standard treatment group will go on to have further treatment to all of the lymph glands left in the armpit. So those lymph glands will either be removed by surgery or will be treated with radiotherapy. Now, the treating doctor will discuss those treatment options with each patient individually. But anyone in the study group will have no further armpit treatment, no further surgery or radiotherapy to their armpit.
What about any other treatments I might need? I think I've been told I might need hormone tablets, radiotherapy after my breast surgery.
Yes, that's an important point. So all patients taking part in the study, whichever group they're in, will continue to receive all the other treatments that are prescribed for them. And this will depend on the type of breast cancer they have, but might include hormone therapy, usually tablets, and also radiotherapy to the breast or the chest wall. The randomization is just for the treatment to the armpit, to the axilla. Does that make sense?
Yes, I think I've got that. I think I understand. Can you just go over it one more time?
Yes, of course. Yeah. So the best standard treatment for your breast cancer is chemotherapy to try to shrink the breast cancer. And this would then be followed by surgery to remove what is left of the tumour. If the chemotherapy also manages to get rid of the cancer cells in your lymph nodes, then it is possible that further treatment to your armpit may be unnecessary. And as armpit treatment can cause some problems, it may be better not to do it unless it was necessary. So at the moment, standard treatment and care after neoadjuvant chemotherapy includes armpit treatment. So we can't simply just stop doing it. We need to do this study to make sure that not treating the armpit is safe for patients.
Okay, I think I've got that. Thank you very much.
So have a read through the patient information sheet, which we've given you. Talk to your family about it. Get back to me if you have any other questions. Otherwise, let's talk again at your appointment next week.
Okay, thank you. By the way, I've got one more question. What does ATNEC stand for?
Okay, so ATNEC stands for Axillary Management in T1 to 3, N1, M0 breast cancer patients with needle biopsy proven nodal metastases at presentation after neoadjuvant chemotherapy, or ATNEC for short.
Oh, wow.
Thank you, Jan.
Okay. Thanks a lot.